people say from cocaine down the line, I don't know.
I'm glad you mentioned that. A few months back, Newsweek had an article about an addiction vaccine.
Yes.
How do you, to me, recovery and sobriety is so much more than the drug of choice and the substance. It's the way we act, our values, our morals, our spirituality.
Mm-hmm. See, it's so nice to hear you say this, Dean, because you came here and you got this.
I was a very broken. I did not have many morals when I came into these doors.
Yes, and I remember to this day having quite a conversation with you, and it's not left my head. But no matter where we go with this, there is no way that just treating the physical side of this disorder will work.
Absolutely.
Because
you're still stuck with you.
Yes, recovery has to be initially about physical health, physical morality, if you will. Not doing things to your body that will damage it, that will hurt it. Taking drugs of abuse, alcohol, cannabis, cocaine, crack, opiates, heroin, are things that will only do damage to your body. In fact, we could say that any drug that you smoke, does incredible damage to your body. So there needs to be a buy-in on this level from a group of people who've always looked to a substance to change the way they're thinking, feeling, or acting.
David, there's people watching today, if not themselves, may possibly have a substance abuse problem. Certainly we know that there's 25 million Americans addicted to alcohol and drugs. Subsequently, there's 3 family members, friends, loved ones for every one of those alcoholics and addicts. So we're talking essentially over 100 million people affected by addiction. What would you tell someone out there, first, that may see signs, and what are some signs that they may have an addiction, or a family member, a loved one, a friend of someone? What can they look for, and more importantly, what can they do? Because I know the most dangerous thing to do with someone that has an addiction is ignore it. So what would you tell the people?
If somebody is in your life who is abusing alcohol, using drugs, one of the best things that you can do is to not become a part of their addiction. So if you are the family member of somebody who's actively using, I would strongly encourage you to look in your paper and identify some Al-Anon meetings. Al-Anon meetings are self-help meetings, 12-step based, for people who have a significant other or somebody in their life who is actively using or has in the past. So at least in an Al-Anon context, you can begin to understand
that it's a disease.
Yes, and that you don't want to contribute to it, and to learn a concept which is called loving detachment. So that as it's a family member, I want to love the family member, but I want to detach completely from their addiction.
That so many people struggle with that.
So that if this is my daughter, then if she's arrested for DWI, then I don't want to bail her out. I think it would be good for her to spend at least an overnight in jail, so that they could experience the consequences of what they did. And I mean, it takes a lot to get to the point where somebody is willing to agree they have a substance abuse problem. So we don't want to hide the consequences and allow that to happen. It is a difficult thing to come into. On the other hand, I would say it is very difficult to live an active addict lifestyle. You have to work pretty hard
to
be an active addict. I mean, every morning you're going to be getting up with the dilemma that you got to go get money to get drugs to get high.
Which is so interesting, because I've always thought addicts are the most creative and motivated people that I've ever meant in my life. I mean, who else could not have a job,
Yes.
be unemployable,
Yeah, absolutely.
be wanted in multiple states,
There you go. I'm sure we have.
not pay their rent,
I'm sure we have.
not have a car,
justice. Yes.
but be able to get high?
There you go. Because that's the most important thing.
Absolutely.
And in a rehab, I guess you kind of peel that onion out, and that's when you realize that your very core is addiction.
Yeah.
And might be addiction with mental illness. But that's the core. But we don't get to the core easy. And that's one of the things that really happens well in an inpatient rehab. We get to the core with people that are willing to go to the core.
Because it's 24 hours, 7 days a week.
You're immersed in it.
There's staff here
Yes.
available to speak with someone
Yeah.
if they wake up at 3 o'clock in the morning.
Craving a drug, thinking I gotta have some heroin, yes, there's a nurse that you can talk to at 3 o'clock.
Somebody wakes up from having a drug dream.
There's a counselor here, or there's a nurse here.
David, I'm so glad we had the opportunity to sit down
It's
and
so nice to see you again.
talk. And if someone wants to get in contact with McPike, how can they do that?
You could call our admission staff. I have to get the phone number now.
We'll get that on the bottom of the screen.
Okay. So they would be they'd be calling either Debbie Donahue or Beth Baldiga.
Okay.
And thanks for technology, because I didn't have the phone number in my head. They also should be reaching out to outpatient providers in their home area.
Okay.
Outpatient. If you think about this, maybe you can try some AA meetings or some NA meetings.
Sure.
If that's not working, maybe go to some outpatient sessions with NA and or AA.
Figure out what level of care they need.
Yes, and that might be a way for people to ease into the system. So it's been a pleasure,
Thank you so much.
and it's been really an honor to have you here.
And until next time, remember, denial only works for a while. Take it one day at a time.